All right, it is 4:30, so welcome everybody to this heart health webinar with Chelsea Senior Living and Fox Rehab. I'm Jason Kahn, the Director of Communications here at Chelsea Senior Living, and with me today is Anthony Ruggieri, who is the Director of Senior Living Partnerships for Fox Rehab. If you had a chance when you were registering, it had our brief bios in there, so you get a chance to know us a little bit better. Won't go through all of that right now, but I've been with Chelsea for about 2 years now. I've had a chance to observe and talk to a lot of our residents and future residents moving in. And I have to say, from when they first arrived at our communities to just a few months after, their progress has been amazing when they were working with Fox Rehab. And I don't like to use this word often, but I will in this case, miraculous. I feel like Fox Rehab really does put out miracles for most of our residents, if not all of the residents who are working with them. So we are glad and lucky to have them as partners, and happy to have Anthony here joining us today to talk more about this really important topic, and that is about heart issues and specifically about cardiovascular disease. And it's not only a topic for older adults, but it's also a topic for people of all ages, to be honest. But with that said, there is a higher risk for people who are getting older with heart issues. So Anthony is going to get into that. That's his expertise, his knowledge. And then the second thing, and Anthony and I, we were talking about this before the webinar, is that really heart health has been on people's minds for perhaps the past couple of months, especially after the traumatic event that all of us probably know about, which happened to the Buffalo Bills player Damar Hamlin. And so while that is unrelated, the topic of heart health has been on our minds, and it's a very, very important topic. So, we're glad to be here and talk about that. We're going to do a Q&A at the end of this webinar, just in case those who are joining us now have any questions. During the webinar, if you have any questions or thoughts, feel free to use the chat window, which should be in your Teams navigation menu there. Feel free to join in and chime in at any time. We're going to try to make this interactive, but I know Anthony has a lot of information, a lot to present, and so I'll stop talking. I'm going to pass it along to you, Anthony, because I have to say, if anyone's the expert here, it is you. And so feel free to take it away.
Thank you very much, Jason. It's a pleasure to be able to present on the topic of a healthy heart, and during this particular month of February. And Jason, hit the nail on the head. This has been a prevalent topic over the last month or so, especially with the Super Bowl and football being on people's minds. And what happened to that player was very dramatic. Probably one of the most dramatic things I've witnessed when watching a sporting event. So it's definitely been, cardiac awareness has definitely been on people's minds. A little bit about me. I'm an occupational therapist by trade. I've been working with Fox Rehabilitation for 9 years in a variety of different roles. Right now, I'm the Director of Senior Living Partnerships at Fox, and I oversee, our relationship with Chelsea. And it's probably one of the, it's probably the strongest relationship that we have. And Jason said that he's seen some residents come in, have Fox, serve them or treat them, and then they come out functioning a lot more, a lot better than they were. I can say that without a strong partner backing our ability to be able to engage with these residents, these success stories that I'll get to in a second wouldn't occur. So it's a two-way street. Chelsea's been a wonderful partner. They're tremendous communities. I highly recommend, as somebody who has a family member looking for a senior living right now. My grandmom right now is living with my mom, and she's about at that stage. I wish she was living in Central or North Jersey instead of South Jersey, because Chelsea, needs to get some communities down there. So
We're
I'd be
working
able
on it.
to put that. I'd have an easy answer if that was if that was the case. So anyway, Fox loves working with Chelsea, and I'll talk about some of the successes that we've had to kick things off, and then we'll get into kind of the nitty-gritty about heart health. What are some of the components of treatment, some of the benefits of rehab, some of the things that you can just do on an everyday basis, exercises, just getting up and moving, risk factors, things that you can prevent, and then things that are kind of black or white. You either have or you don't. So we'll get to some of those things in a second. So let's start off with some success stories here. Here's one from Chelsea at East Brunswick. I have my strength and endurance back to attend family gatherings. And I think on this, it actually says all day family gatherings on this little sheet here. So to be able, that's probably one of the most important things, is to enjoy time with family. And so that was definitely a positive. They, Christmas, Thanksgiving, spending time with family and friends is valuable. And so that was a good one. Here, Matilda, I can now stand for 20 minutes. Speaking of cardio, stand for 20 minutes and put on all of my makeup in front of the mirror. I used to sit and I couldn't see what I was doing. So it might not seem like
Wow.
a big deal, but this is an everyday task that somebody wasn't able to do that, now they're able to take part in.
Amazing.
And then finally, this one, I just love her smile. For the first time since I moved into Chelsea in April, I am walking to my meals independently. So again, these things are, you take them for granted, but they're important and they mean something. And they seem like they're small, maybe small things, but they go a long way, and they impact somebody on a daily basis. We might take them for granted, but they're important. So there's 3 success stories to kick off. We have tons and tons more, but we only have a half hour here. So I guess we'll move into the presentation on healthy heart. So I worked alongside, like I said, I have a background in occupational therapy, always coming at it from a functional standpoint, but I did work with our quality assurance department at Fox, which is second to none. Fox has been treating geriatrics for 25 years now, and that's the only population we've ever treated. So our quality assurance team constantly comes up with education, the latest and greatest things to train our clinicians on, so that they are able to treat residents and patients adequately. So here's a little bit of the agenda here. What is cardiovascular disease? Prevalence, risk factors, which I think I'm going to stick to for a little while. I think that's most important. Prevention, and then types of cardiovascular diseases. I'm not going to go through all the types just because there are 10 or so, but we'll hit on the big ones. So what is cardiovascular disease, or CVD? It's a pathological state which compromises the function of the heart and or blood vessels. It includes heart disease or diseases of the blood vessels. There's a quick fact here. In 2019, 32% of all deaths globally were due to CVD, 85% of which were due to a heart attack and stroke. So as we can imagine, heart attack and stroke are probably the most prevalent and well-known cardiovascular diseases. What can you do to prevent CVD? Know, identify, and act. Know the risk factors, identify your risk factors, and then take action with what you can take action on. Some are inevitable. They're going to, age is one of those things. Your genetics, things like that. But there are risk factors that you can take control over and help to lower the risk. So those would be they would be called modifiable risk factors. Some of those are high blood pressure, high cholesterol, smoking, obesity, a sedentary lifestyle, type 2 diabetes, excessive alcohol intake, and then illegal drug use or drug use of any kind. Let's see. So the non-modifiable, I said age already. Heredity, race, gender, a previous heart attack or stroke, type 1 diabetes. Something came to mind when the sedentary lifestyle. I mean, that was, again, going back to my grandmom, I'd say a couple years ago. She was depressed. My grandfather had just passed away. She slept all day. She didn't really, do much. She would just kind of lay around the house. She was still living with my mom at that time. And then a couple years ago, I started dropping off my daughter, Lila. I took her about 3 days a week over to my mom's. And sure enough, I mean, it didn't take long before my grandma would get ready. She would do her hair and makeup. She'd come down, spend most of the day with the baby. And she still does that to this day, 2 years later. Other than that, like, she's laying around most of the time. But when it comes time to see her granddaughter or her great granddaughter, excuse me, she comes down and she gets ready and she gets up and moving, and it's a real motivating factor for her to move. Honestly, I think that she's doing better now functionally than she was 2 years ago. And my mom, was getting to the brink of trying to, find a place for her then. But I think she's doing a little bit better. And that's part of the reason is because she's more active than she used to be. So it's whatever that motivation is, if you can find that for your loved one and get them up and moving, it goes a long way.
Yeah, and that's what I hear from a lot of our residents, actually, when I talk to them, Anthony, is that yes, FOX Rehab definitely helps them. There's no question about it. At least 90% of the way, but it does take at least another 10% of them to be motivated and determined to want to improve, to progress, to get better. This is a two-way street, not a one-way street. So it does take a little bit of effort from the resident themselves, the senior themselves, to want to improve and to be motivated, just like your grandmother.
Mm-hmm. Like anything else, it's it's a collective effort. So the Fox can get them back functionally where they're able to get to a place, but it's up to them to be motivated enough to actually do it. And it takes skill from the staff at Chelsea to be able to follow through on some of the things that maybe the therapist left as far as notes post discharged for the staff actually, and the nursing staff to be able to follow up on. So everybody's involved in getting somebody back to a functionally well state. All right. Make healthy life choices. So consult a couple things here. Consult your physician to manage high blood pressure, quit smoking, increase activity level. And we'll get to specifics on activity and what the CDC recommends in terms of amount of exercise. Consult your physician to manage your diabetes, eat a healthy, balanced diet, consume alcohol in moderation or not at all, and then learn techniques to lessen the effect of stress. Those are the most important lifestyle choices. All right. We talked a little bit about this. I mean, I have another story too. I think all of us probably have multiple stories, but my grandfather, he was in an independent living for a long time. And I would always go and visit him, and I'd always see his like exercise band like hanging on his walker or his chair. And he would always, I would ask him, "Are you going to therapy? Are you going to therapy?" And he would always say, "I don't need it. I don't need it. I can exercise. I have my own equipment." But sure enough, that exercise band sat in the same spot for God knows how long. Meanwhile, he went from a rolling walker to a rollator to one motorized scooter to two. He had two scooters at the end, towards the end of his life, where he would be riding one all day, the other one would be charging, and then he'd come back and switch them. And you know, he was stubborn old Italian man. But yeah, it shows you how important. I think if he did go through with therapy, he would have definitely been able to function a lot better. And he did have an issue with falls towards the end of his life. That might not have been there if he followed through with therapy and listened to people that were advising him to do it. So physical and active adults are more likely to develop heart disease. Studies show a higher rate of cardiovascular events and a higher an earlier death rate in those with low levels of physical fitness. So regular, moderate to vigorous physical activity improves your cardiovascular health and helps reduce your risk of heart disease. It says here, the effects can be dramatic when combined with other lifestyle modifications like proper nutrition, smoking cessation, and medication use. Exercise, and again, we'll get deeper into the amounts of exercise that are adequate to help you. But exercise helps you lower blood pressure, control blood cholesterol levels, lower LDL, which is your bad cholesterol, and raise HDL, which is good cholesterol. It allows you to reach and maintain a healthy weight and manage your diabetes. Oh. All right, so let's go back here. For heart attack patients who participated in an exercise program, early death rate was reduced by 20 to 25%. So that's a staggering number. And here's another one. Only approximately 30% of Americans are active enough for good heart health. Less than 1/3 of Americans meet the minimal recommendations for activity, as outlined by the CDC and others. Wow. That gets back to like being able to do it and actually doing it. So, there's a lot more than 30% of Americans that are able to get out and run or exercise in some way, go for a walk, but many don't. All right, here we go. More specific here. Every American adult should participate in 30 minutes or more of accumulated moderate intensity activity on most, if not all, days of the week. Moderate activities include yard work, household tasks, cycling, swimming, say walking. So it doesn't have to be, you go out there and run 5 miles. Just moderate activity. Like me, recently I've been sitting at a desk for the past couple days, and I'm like chomping at the bit to start, walking and moving around. Maybe your everyday life allows you to move without you having to go to a gym because you're up and moving, out and about. So, we'll move on here because we're gonna get down to the wire if I keep going into the nitty gritty. Here's another fun fact here. Researchers estimate that there could be a 30 to 40% reduction in cardiovascular events if most Americans were simply to meet the government recommendations for activity. So when on a grand scale, that's a lot of people that could impact if people would get up and get moving. Easier said than done, I know, but these are the different types. I'm not going to go through all these types. I will, Jason, I can send the material as a resource.
Sure.
That you could forward over with the recording.
Absolutely. That would be great.
We know, yeah. I mean, I would just say heart attack and stroke are the main ones here. Heart failure. And I'm not going to get into the components and the benefits of treatment. Again, this is from a therapy standpoint, what we do as part of our treatment, which really is, again, it's repetitive task training. It's intensive rehabilitation or rehabilitative focused utilization of our time. So, with outpatient therapy, I don't know, with some companies you might be going out to a brick and mortar and you're in a simulated environment. Maybe they have a couple people in there and they're treating a couple people at once. At Fox, we treat one-on-one for a full hour, many times 3 days a week. We can go up to 5 days a week. So the nice thing about what we do at Chelsea with Chelsea in collaboration is if somebody were to leave the community and go to the hospital, instead of going to a skilled nursing facility, they can come right back to the Chelsea location, and we can see them. Fox can see them for 5 days a week for PT, OT, even speech, and then we titrate them down from that. So it's not necessary all the time that they're going to be spending the time at a sniff. So if you have a loved one who's falling all the time and it's inevitable that they're probably going to just have to go to the hospital to get checked out, at Chelsea, you're going to be aging in place a lot more than you might at another community. So the way that we work together, I think in collaboration is very important and effective. All right, we have a quiz now. Jason, it's up to you how you want to format this. If we want to try, I mean, we have 7 people. You want to try the poll or what?
I think that we can try the poll. Well, I was going to say we can try the poll. I mean, we have some time here. We have another 8 minutes. So I am going to launch this poll, which is a replica almost of the quiz that you see on your screen right now. And feel free, for the people who are currently attending here, feel free to respond to these questions that are about to pop up on your screen. This is new. We haven't done this before, so hang in there. Hopefully it shows up for you. It should pop up in your chat window. If not, it should just pop up directly on your screen if you're on a desktop computer. I'm not sure if it'll be different on your mobile phone, but feel free to answer some of these questions and go through each of these questions, and then we'll give it another couple of minutes, around 4:55, we'll say, and Anthony will take us through the first 9 questions here. We'll do that briefly, and then after that, we'll wrap it up.
Smooth sailing, Jason. This is our first one, hopefully of many.
That's right. Yeah. I am. We definitely plan on having more of these in the future. So, those who are watching this, I know that will be, some people who are watching this right now. This is the recording of the live version. Those people who are on right now, I appreciate you guys attending and watching this. But it's been very informative. We have so much information between Chelsea and Fox. There's so much information, we may have to extend it a little bit next time, but I think, within a half hour, we really try to pack it in with as much information that's helpful to our current residents, families, even staff members who really need to, who are really looking to enhance their knowledge about this topic. I think this is really helpful too. So
yeah. I mean,
I think this has been great.
I talked a little bit about some of the internal things that we do to educate our clinicians, like that, having a quality assurance department to keep up with the latest education. We also have in-services that we collaborate with Chelsea to provide their staff. So that education that our clinicians are getting and our regional folks, we're passing that along to Chelsea nursing staff. And hopefully educating them to a point where they can follow up our plan of care seamlessly and continue to help that resident function and make gains and just live their life, the best that they can.
Absolutely.
So can we see the results?
We can. So let's give it just a couple of seconds here. Kareen, Sorry you're unable to see the pop-up. It does show that there is a response. Not sure if that was from you, Anthony, from earlier, or if that was somebody else. But let me close the
That's all right.
quiz, and then we'll take a look. Okay.
All right.
So yeah,
Oh, good.
are you seeing the results there on your side?
Yeah, I am.
Okay, good.
And the first one was the trickiest one. So I actually, the first go round of doing this quiz, I also put true. But according to my answer sheet, number one is false. So number one was you can prevent heart disease by being physically active. True or false? You can't prevent it, but you can lower the risk. Essentially, is the answer. So it would be false. But that was kind of a trick question.
Trick question there. All right, let's go to the next one.
I didn't. By the way, these questions are coming from the American Heart Association, not
All
Fox
right.
or myself.
Gotcha. So don't go after Anthony.
Don't shoot the messenger.
Yeah, exactly. All right, number two, physical activity can counteract the harmful effects of other risk factors like high cholesterol and high blood pressure. We have false as the response.
And I believe that is true. I'm going to go to my answers here because we already did the poll, right? It is true. So number two is true. Studies show that being physically fit lowers heart disease risk, even in people who have other health problems.
Okay.
All right.
Number three, how much physical activity is enough?
All right. I know this one. Don't have to look at the answer. This is 150 minutes weekly. So in the PowerPoint, it said 30 minutes, 5 days a week, if not all days a week. So 150 minutes weekly. 20 minutes daily is pretty close, though. You do the math. 20. I'm not going to do the math now, but I think that's pretty close.
Number four, lifestyle changes may be the most difficult to overcome. All of these are known to contribute to heart disease, except for
there we go. That's right.
There we go. I think that makes sense. I don't think we need to go over that one.
No, that's pretty obvious. That was
number five. Number five, you don't get health benefits from exercise unless you are exercising vigorously. True or false? And we have false.
False. That is correct. No pain, no gain is kind of it's not true.
Women get the same.
You don't want to be hurt. Yeah.
Sure. Women get the same benefits from being physically active as men. True.
This is false. This is false, believe it or not. Women actually can get more gain from exercise. So I don't know how that's phrased here. Let me just real quick. Studies indicate that women may benefit even more than men from being physically fit. I'm not going to read it all, but yeah.
Look at that. I guess we got to put in more work, Anthony.
That's right.
Does your body need sodium? Yes, no? Yes. Yeah. Okay. Is there a direct relationship between sodium intake and blood pressure? Yes or no? And we have yes here.
Yep. Yes.
Okay. And then finally, does most of the sodium that Americans eat come from salt added at the table? And we have no as a response.
That is correct. 75% of dietary sodium comes from processed foods. Unfortunately, yeah. So that person that participated in the poll, thank you so much. They had a rough start, but then rallied at the end.
That's right. They were resilient.
Yes.
They were definitely resilient. So, Anthony, do you have anything else you want to add before we wrap things up here?
Let me stop sharing my screen here. I don't have anything else to add. I think all that's said that needed to be said was said. I just want to thank you, Jason. Thank Chelsea for hosting this. Like I said earlier, Fox couldn't do it without a strong partner like Chelsea Senior Living. We've been working with them for quite a long time. They're an excellent partner, and we hope to gain more and more success stories as the years go on here.
And if anyone else has any questions, you can email Anthony. His email is Anthony Ruggieri, Ruggeri, at foxrehab.org. So feel free to reach out to him with any questions you have about this topic or just in general about Fox Rehab. I see that you just put that in the chat window there,
Yep.
Anthony. I'll also put my email in the chat window in case you'd like to reach out to me as well. And we are definitely happy to help assist you, answer any of your questions, whether you currently have a loved one at one of our communities, you are a resident at one of our communities, or you're thinking about joining one of our communities. We're happy to have you here and answer any of those questions. But we are at the 5 o'clock hour now, so we don't want to keep anybody too much longer. So I'm just going to wrap it up and say thank you again, Anthony, for helping share all of this information. It's been great having you here. We'll work on getting a community down in South Jersey for you.
Yeah, that would be ideal. Yes. Thank you so much. No, it was a pleasure. Thanks for having me.
All right, everybody. Have a good night. And we look forward to having you in our future webinars. See ya.
All right. See you later.
Thanks, everyone.